Belgium. As you see on the left side of the screen, we have some beautiful nature as well, and I came here to do this fellowship in Asan, where I did find some beautiful nature again, as you see on the right side. So let me tell a little bit about myself in this introduction. So I'm a plastic surgeon and also I'm a physiotherapist. So I'm really interested in biomechanics and in the concepts of training and recovery of the body. For example, when I was physiotherapist in training, I did with our department a study on genetics, and as you can see in the top picture, you see the bull. It's called Belgian Blue. So this kind of cattle is very specific for Belgium, and they have a gene mutation in the gene myostatin. Myostatin is a gene that will slow down muscle growth. So if you have a mutation in this gene, the muscle growth will be enhanced a lot. So we were interested, like, okay, do we see this in human as well? But there are only few cases described. As you see on the right side picture in the top, there was a male child who was homozygous for the mutation in the myostatin gene. And you could already see at 6 days on this left picture, and then again on 7 months, that there was some muscle hypertrophy in the calves. However, this is very rare to see it in a human. So what is more often described are gene mutations in this same pathway. So we had a look at the follistatin and activin type 2 receptor B, and we took all the samples and we did the genetical analysis. However, we could find any significant association with muscle strength or muscle volume, but it was a very interesting research, and it's still a little bit of a debate because other groups they did found an association. Also in plastic surgery, I'm interested in scientific research and in some innovation. So I was part of the research team during my training as well. I was in a team of traumatology, and there we did find something interesting about the posterior malleolus fractures, you see here. So in the past, we were convinced that the fracture parts of 25% or less, that they were not significant for postoperative rehabilitation. So when the joint surface was damaged in the AP view, damaged for 25% of this whole surface or less, they were not treated. But we did see that these patients had a way faster osteoarthritis within 5 years, and that they had a lot of complaints of pain and problems with joint mobility. So actually this was the start for following studies, and they confirmed this, and now we also have a new standard of care to reduce and if necessary do the fixation of this fragment. So I think these are all interesting things, and it's very nice to be involved with research and try to make to have a better insight and to make better standards of care. Also the innovations like Da Vinci I'm interested in. However, what I wanted to say with the bottom part of this slide, you can see the Congress. It's the Solvay Congress, the 5th Solvay Congress, which is held in Belgium, Brussels, in 1927. And they were actually discussing the basics about quantum mechanics. Quantum mechanics, one of the features you probably know is that the smallest particle can be described as a particle or as a wave. And actually, when you work on this theory further on, they saw that the laws of Newton we use every day, they are only like applicable in specific situations, and they are a simplification of reality. Another aspect of this theory is like what they call the quantum entanglement, and it's saying that two very small particles, even if they're extremely far away from each other, they can be linked. And if you change the state of one particle, it will influence the state of the other particle. So what I wanted to tell is that actually here we live in a very simplified assumption of reality, and we are probably not aware of all the processes and variables influencing what we experience in daily life. So if we do find something in research, we have to be very, very careful with making conclusions, because we only have a very limited view on this aspect of life, and we are not aware of all the processes, and they are not even described yet. So I think we have to be humble and always double check, and be very careful with your information. So this as an introduction. I was trained and I worked in the university hospitals in Leuven. And a little bit more about Leuven. So it is a city from Andreas Vesalius. He lived in the 1500s, and he's actually the founder of modern human anatomy. He has written this book, De Humani Corporis Fabrica Libris Septem, and his dissections, the story is told that his dissections were based on cadavers that he found on what is called Galgenberg. And Galgenberg is actually the place where they hung up the people who were convicted with death sentence. And he took these cadavers and he took them to his place and did the dissections. And the place where he found these bodies, the story is told that this is also the place where our hospital is now. So, interesting historical knowledge. And we are trained and we work in the university hospital, and this is working together with the Leuven University. Okay. So as a plastic surgery team in Leuven, we are quite all round. We do most of reconstructions from head and neck to breasts to extremity to lymphatics. We started as well. So we are very all round, but maybe one special thing I can describe for you. This is a collaboration with our ENT department. In order to try give solution for long stenotic tracheal segments. So what we do is we take a donor trachea and we cut the membranous part so that it folds open like a book. And then we prepare the muscle fascia of the forearm, which is connected to the radial artery and vein. And we place this donor trachea in the forearm, and the muscle fascia with the artery and concomitant veins is wrapped around this donor trachea. We let this heal and we cover this with a Gore-Tex patch. And every 2 weeks we check. And once we see that there is new vascularization from this fascia growing into the trachea, we place buccal mucosa grafts from this patient in the inside to make a new inner lining. In this way, after about 3 months under immune suppression medication, we have a kind of package with tissue of the patient itself. We have the muscle fascia and the buccal mucosa. And then we clip the pedicle artery and vein, radial artery and veins, and we bring it up to the neck, where this stenotic segment of the trachea is resected. We replace it by this segment, and we do the anastomosis to the neck vessels. And after 12 months, we are able to stop immunosuppression, because actually the tissue is very well hidden in the own tissue of the patient. So I think this is something very new, and we have around, I think, 12 up to 13 cases now, with up to now a good follow-up. Some of them needed some ballooning afterwards, but the result is very decent. Okay, so since I've explained about my background, I'm interested in biomechanics, so I'm definitely interested in extremity recon. But another thing that I'm interested in is the facial palsy, because I think one of the strongest things as a plastic surgeon is that you're able to reconstruct function and as good as possible aesthetics, and this can be of big importance to your patient, because by combining function and aesthetics, especially in the face, you can restore the social and psychological well-being of the patient. And this is like an extra layer, not only doing micro-anastomosis, or not only restoring function, or not only restoring aesthetics. If you can combine this, I think this is of a huge benefit for our patients. So the goal of the visit to Asan was to learn about the supermicrosurgery, about thin free flaps, lymphatic surgery, the ultra-high frequency ultrasounds for the mapping, and I wanted to see the approach in Asan for facial palsy reconstruction, and I wanted to be involved in the research. So that's how my trip started, and first I landed in Bangkok, and then I went to Seoul for the Asan Medical Center. So Bangkok, there was the lower extremity workshop. This was actually a very good kind of kickstart, because you learn about the insights and the theories, the way of thinking of the people here in Asan, and also from Japan, like Takumi, during their lectures. And then we had a workshop on the ultrasound, also on lymphatics. We had a lot of workshops and live surgeries, and in the end we were able to do cadaver dissections of several types of flaps. So for me, this was a picture with the ultrasound. It was the first time trying the ultrasound. And for me, this was actually a very good way to start, because it gave me already some knowledge before I arrived here in Asan. And then to Asan, and there were even more congresses and workshops. So actually I'm very glad that I was arriving around October, because this was really fully packed with workshops and congresses. So you you had the whole package of information, the whole way of thinking you were familiar with during these first months. So quite early we were involved in this research program. We were participants for combining or comparing the robotic Simani micro and supermicro anastomosis, and comparing this to the hand sutures. So in total we did 64 actually supermicro anastomosis, half of them by hand and half of them with Simani. Even these were divided in between a group of around 0.7 and another group around 0.3 millimeter. So this was a very important training for me. Then we had the lymphedema workshop in Asan. We also had our symposium. Here you have a picture of the lab facilities we can use here in Asan and the Simani robots. We also had the ultrasound workshop, so Professor Park introduced me as being an instructor for the ultrasound workshop, and actually this was very interesting to me because you're forced to take it to a next level and try to explain to other people, and it was very interesting, and I think this was also a good encouragement to learn more about the ultrasound. And then we had the PRS Korea, where we could see Paul Sederna explaining about his neuroprosthesis, also something that I think is very interesting and can be a good application in the future for our patient with an amputation. So a lot of interesting things, and then in the meanwhile, like the daily life started in Asan, day in the life of Asan. So we start in the morning with helping in the dressings. Here is our dressing team. And then we are assigned to surgeries, so we can assist in surgeries. You see me learning from our extremity masters. And then after surgery or in between surgeries, we are able to see ongoing projects. Like here we can see a project with Professor Park about the neuroprosthetics. We are also able to train in the lab. And I also use this time to see as much as possible of the bony flaps in the C-team and the facial palsy reconstructions in the C-team. And then at the end of the day, we do the preparation for the next day. We use the ultrasound to do the mapping for the patients, and we make reports. So that's about it for the day in Asan. So in this way, we learn a lot about the planning, about surgery, about research. So it's a nice package. We are also involved in the research, so I had the opportunity to write a chapter about imaging in flap surgery and lymphatic surgery for the new version of the first book, and then a chapter about lymph node to vein anastomosis for the new version of the second book. And then the other research is still going on, so with Professor Su, we have this nice systematic review we're working on, where we want to try to have an overview of possible covariables in the LVA surgery in order to have a more standardized and structured way of doing the research. We're also working on the video-based AI device with Professor Park for the flap monitoring. And if you have the time, you should have a look together at this overview article about neuroprosthetics. I want to discuss it with you guys and finish this. And then one of my students is working on this last topic about management concept proposal for chronic Crohn wounds after resection of the lymph nodes and radiotherapy. It's about combining the flap surgery with the lymphatic surgery in order to give a higher chance of a good coverage of the wounds. So I think I could progress in a lot of the goals I had on the start of this journey. So we were using the ultrasound many times, so there is still a lot to learn with the ultrasound, and I will definitely have to practice a lot back in Belgium. But I think I already have made the foundation here. This helped me as well to have more insight in the concepts of the thin flaps. We had already good training for the supermicro with the lab training and the assistance in the OR. Also about lymphatic surgery, I learned a lot. On the right side, this is my first LNVA. And I also was able to discuss a lot with Professor O about his approach to the facial palsy reconstruction. And I learned a lot about this, and I will try to make a mix in between his approach and the Leuven approach. Actually, by seeing and also talking with the C team, I was realizing that it could be nice to have another 3 or 6 months with the C team now.
Yeah.
But yeah, I think I have to start in Leuven. So yeah, that's about it. So thank you very much. These are pictures of some nice moments, like you guys provided a very nice cake for my birthday. Photo with Jimmy and then with Sebastian with the Taekwondo. It's also something like nice to tell about the belts in the martial arts, and it refers to my first slide. Like in some Asian countries, you can train from white belt to black belt and then first dan and then up to maximum level. And then the real senior ones, some of them, they start again with wearing the white belt as a sign of showing that they now realize how much they still have to learn. So I think it's a very nice way to show that you have to be humble and try to have as much information as possible, but keep in mind that our human brain is limited, and we also always have to be careful with our research and new information. So thank you very much for being part of this team, and I'm really sure that we can keep in touch and maybe build a new relationship for having a quicker exchange for fellows and research and congresses. Thank you.
So did you get the answer of the Schrodinger's cat, the uncertainty principle?
I did not get all the answers yet. No, I did not. But it is indeed, we are not certain about the position of a particle. So you can only describe like the chance that the particle will be there. Yes. So Schrödinger was also in the picture.
Okay. Jos Velleman, the Department of Plastic Surgery at Asan Medical Center, University of Busan, acknowledged the completion of fellowship. He participated as a key member of the team, achieving the clinical and academic goals. We will cherish his friendship and wish great fortune in his days ahead.
Thank you very much. Thank you.
그룹 해? 먼저.